Welcome to my presentation on aromatherapy for stress reduction. My name is Terrence Shenfield, and I am a respiratory therapist for the last 30 years. I am also an education coordinator for University of Medicine and Dentistry in Newark, New Jersey, and I received a master's degree in complementary and alternative medicine. I believe aromatherapy should be an integral part of the care we give to patients, and this is all coming to light when we think about integrative medicine. So what is stress? A stressful situation, whether something real like you're about to be attacked, or you're diving away from a speeding car, or it can be a looming work deadline, or a psychological stress such as persistent worry about losing your job or a bad relationship. All of this can trigger a cascade of stress hormones that produce well-orchestrated physiologic changes. The same stress response applies to being a patient, new people, new procedures, or hearing a horrible diagnosis. All of this can add stress to your life. A stressful incident can make the heart pound and breathing quicken. It can make muscles tense. It can make beads of sweat appear on your forehead. This combination of reactions to stress is also known as a fight or flight response because it evolves as a survival mechanism, enabling people and other mammals to react quickly to life-threatening situations. The carefully orchestrated yet near instantaneous sequence of hormonal changes and physiologic responses help someone to fight in a threat or to flee in safety. Unfortunately, the body can also overreact to these stresses that are not life-threatening, such as traffic jams, work pressures, and family difficulties. Over the years, researchers have not only learned why these reactions occur, but also have gained insight into long-term chronic effects of stress. Over time, repeated activation of the stress response can take its toll on the body. Research suggests that chronic stress contributes to high blood pressure. It also causes changes in the brain chemistry, leading to anxiety, depression, and addiction. The fight or flight response, which is called the SAM pathway, and long-term stress is regulated by the hypothalamic pituitary adrenal axis. It stimulates the pituitary gland to secrete ACTH, and then ACTH further stimulates the adrenal glands to produce cortisol. When cortisol is released into the blood, that even creates more problems. Stress can be both internal and external based upon the situation. So the question is, the long-term effects of stress have a certain impact on your body, and actually it's a profound impact. It impacts three main areas: your cardiovascular system, your immune system, and your brain. For example, people who have long-term stress have an increased risk of stroke and heart attack. They are predisposed to hypertension and can have all kinds of cardiovascular issues. On your immune system, people who are stressed actually are more susceptible to infection, and their immune system is really not primed. There's a whole science called psychoneuroimmunology, and they believe that if you're under stress, you will not heal as quickly as someone else who's not under stress. They also believe that if you have positive affirmations in life and you have a good relationship and you have good family support, that your immune system will be more prime. Those who are alone and don't have nobody and are depressed and they have anxiety and so on, and they're under a stressful situation, they don't heal as well. In the brain, stress hormones affect memory. For example, long-term stress on the brain can result in anxiety, insomnia, and depression. I'm a pretty normal guy for myself, I like to think, yet if I go under stressful situations, it comes right out on me in insomnia. I don't sleep very well. So I try to manage my sleep, and I try to manage my stress, and I try to manage my life. So how would you go about joining our webinar? Our webinar takes place on October 8th from 3 p.m. to 8 p.m. Eastern Time. You're going to access the webinar by Zoom, which is a free app that you could just download on your phone or your laptop. What you need to do is go to our website, which is www.atecam.com. Again, that's www.atecam. Look up webinars and you'll see this webinar that we're offering on October 8th. The cost for this webinar is $30. And this is a live webinar. ATECAM is a provider of nursing education. So at this event, we're going to be offering 5 nursing contact hours. And even though we're from Pennsylvania, even if you live in New York, New Jersey, Pennsylvania, Florida, Idaho, wherever you live, these nursing contact hours count. So I hope you join us, and this is going to be a great presentation.